Good evening, all. On behalf of the digital media team of IAP, I, Dr. Smarnika Das, IAPWC State Coordinator from Goa, welcome you all to this webinar. So the topic of this webinar today is aquatic therapy and gaps in research. Today's moderator is going to be Dr. Palasha. She is the North Goa District Sub-Coordinator. The resource person for today is Dr. C.G. Prashant, who is an experienced physiotherapist coming from Australia. I would say all the best to you both, sir. And so I hope that this webinar is an interactive and informative one. From here, Dr. Palasha, you can please take over.
Thank you so much, Dr. Smarnika. So good evening, ladies and gentlemen. Today's webinar is hosted by IAPWC Goa. My name is Palasha Sardesai, and I'm delighted to be your host for today's webinar on aquatic therapy gaps in research. The webinar is going to be 45 minutes duration with 15 minutes of Q&A. Let me introduce you to our esteemed speaker. I'm excited and delighted to have Dr. C.G. Prashant speak on this topic. Dr. C.G. Prashant is the founder of Aquatic Therapy Network of India, ATNI. Originally from Mysore, he completed his graduation from M.V. Shetty Institute of Health Sciences, Mangalore in 1998 and became a lecturer at STM College of Physiotherapy. He then completed post-graduation in neurological and psychosomatic disorders, becoming the unit head of the PT Department of Neurology. In 2005, he developed interest in aquatic therapy, and after training about 1,500 hours, he has become the assistant lecturer in water-specific therapy for IAFT, International Aquatic Therapy Faculty, Switzerland. After establishing ATNI, he is now a trained Aquatic Exercise Association fitness professional. This year, Sir has also been elected to be holding the position of co-chair of Worldwide Aquatic Body Work Association. Thank you so much, Sir, for being here today, and I would love to hand over the stage to you. Over to you, Sir.
Thank you, Palasha. It's a great pleasure and an honor to be speaking on an IEP platform again after many, many years. I think we did one of a two-day program in Pimpri-Chinchwad with IEP branch many years ago, maybe in 2010 or 11, I don't remember exactly. But I think this would be my third or fourth talk on an IEP platform. We've spoken in conferences, we did some workshops, also as a pre-conference workshop and things like that. And I appreciate this invitation, and I thank Dr. Smarnika and also Palasha to host me on this platform. And when they asked me for a topic, and I said I was wondering what should we speak about, because we have been speaking about aquatic therapy and its introduction, the fundamentals, the hydrodynamics. I think that information is already out there very clearly. But in line with our vision, what we wanted to have in India and to promote the growth of aquatic therapy, we focused on three things. One was education and awareness. Second one was on infrastructure development. And third thing was on research. Education and awareness has come a long way. A lot of people have become aware about it. There were many measures taken on this front. And as far as education is concerned, there are many courses happening. Many resource people are taking courses. And so education is being taken care. Now, what is lacking is in research, because aquatic therapy is a young baby in India as it grows more stronger year by year. And there are many professionals who want to come into the field. There are many swimming pools which are being used for therapy. And there are many therapy pools that are being designed and installed. So it is very important now we start looking into developing right evidence so that aquatic therapy can be a very sustainable concept. This is my brief professional profile. I just wanted you all to have an idea that just like physiotherapy, aquatic therapy has got lots. It's a big world, and there are a lot of concepts, many organizations, and many of them are working towards making aquatic a unique field, which essentially means it's not only being used by physiotherapy professionals, it's also being used by occupational therapists, it's also being used by fitness practitioners, it's also being used by holistic practitioners. So we have to understand that the world of aquatic therapy is not isolated to only to physiotherapy. It's a very big concept, and a lot of people are working in it. So this brings in itself a challenge to understand what part of evidence we should be looking into, what part of concept are we trying to apply to the patient, what is the level of evidence present in these concepts. So that's why this topic would highlight not every aspect of it, but certain critical aspects. I hope I'll be able to bring that information to you. What is the learning objectives? First is to identify aquatic therapy as a growing field in India. This has to be established, and identifying research as an essential tool for the growth, and understanding areas of deficits or gaps in the research, and some simple strategies to overcome some of these gaps. This is a very short time, and I'm trying to speak about something which is like a movement that has to happen. When I say a movement, it means that everybody has to take part in research as if it's the next biggest thing, and that is supposed to happen in India. And that's how the research has to be looked into now at the moment. But this time and this platform is maybe an initiation to look or and to bring awareness about this particular research, need of research in Aquatic Therapy Network of India. When we started this organization, we had to define aquatic therapy for India, and maybe this definition may hold good for many other places. So we have defined this under the guidelines, standards for aquatic therapy in India. It has been defined as a set of therapeutic procedures applied in a therapeutic pool by certified practitioners. All these three things are important. When we look into research, we have to know that aquatic therapy is just not any other tool. It is a set of therapeutic procedures. There is a certain line of thinking to it. There is a certain level of clinical analysis. There is a certain level of clinical reasoning to the choices what we make in deciding our procedures. It is applied in a therapeutic pool, which essentially means the pool is not a regular swimming pool. It has its own property. It has its own entry-exit pathways. It has its own design that would be essential for treating patients. By a certified practitioner, which means that it is not an everybody's tool. You have to be certified as a practitioner to deliver this technique to patients. And what does this do? It is in bringing about physical, physiological, psychological, and therapeutic. There are 4 domains it influences. We have kept this as physical, physiological, psychological, purely from the perspective that it is not only used in clinical scenarios, it is also used in general scenarios where there are physiological changes, and there are psychological changes, and there are physical changes, which can happen in any individual. And when we mention therapeutic changes, it is specifically associated with patients. So it is a set of therapeutic procedures applied in a therapeutic pool by a certified practitioner in bringing about physical, physiological, and therapeutic changes in an individual. How do we do this? By using the properties and hydrodynamic principles of water. And by using this, what do we achieve? We want to maintain, improve, or restore body structure and function, to overcome activity limitations, and to facilitate participation to fulfill their roles independently in daily life. This whole definition appears to be complex, but it is very comprehensive. We have kept ICF into the parameters when we were defining this, and this took us almost 1.5 years to develop, with a lot of collaboration between national aquatic therapists as well as international practitioners. So this is a very comprehensive definition. So you would understand how a research should be focused on, because we are defining aquatic therapy, and from there, whatever methodologies we choose, whatever patient population we choose, can all be comprised under this definition. And I think research is something all of us are familiar with. This word is quite common for us right from our undergraduate, more common during our post-graduation studies, and also very important when I'm doing a PhD. So what is this? In a simple term, it is defined as a creation of new knowledge and or the use of the existing knowledge in a new and creative way. So there are two things. One, we have to create a new knowledge, and the second thing, use of the existing knowledge in a new and creative way so as to generate new concepts, methodologies, and understandings. At the same time, it can also include synthesis and analysis of previous research. Now, there have been many researches that has already happened, and a research can also mean that we are going to analyze that research and try to understand whether does it lead to new interpretations or does it lead to new outcomes. So this is the concept of research. Why research is important? This is a crucial question, and I think all the academicians would understand it. We study it as a subject, but today I would like to emphasize on this from a practitioner's perspective, from a clinician's perspective. Because in India, clinicians do see a lot of patients, and the whole idea of seeing patients is to make a living. Of course, we earn this livelihood from our profession. But in the long run, what happens is we become so busy with practice and so occupied with traveling one place to another place, from seeing one patient after another patient. The research slowly starts going on a backseat, and at some point, we don't look at any researches. Now evidence-based practice is coming into forefront, and a lot of people are saying that, okay, we have to start looking at evidence and make a decision, but somebody has to create the evidence, all right? So research is very important. And in my perspective, because I've been on an academic side, as well as now I'm in a total clinician's position, I feel clinicians contribute a lot to exactly understand what works for the patient. And so it is very important that they participate more in research and share their success stories and identify what method worked best for the patients. I'll speak a little more about this as we go ahead, but to generally understand is to build knowledge base and enhance learning, to understand the reasons for change and improve awareness. If I have a limited knowledge base, especially in aquatic therapy, the knowledge base in India is not very large. It's very little, or it's in the beginning. So we have to build our knowledge base in this area, and we have to enhance the learning from this perspective. And when our patient goes into the pool and suddenly finds that he's walking better, his posture has become better, it becomes very important to understand that what caused this change and what brought about this change. And when we understand this change, the awareness for this increases. A lot of people will come to know about it, and they will be able to spread the word, and generally the concept will sustain. I see somebody has raised their hand. Will the question answers be now, or would we be discussing later?
So you can continue. We'll take the
Okay.
question and answers later.
In the end. Okay, sure. And it also disproves wrong assumptions. Whenever I do a research, somebody is telling something, and the public may have different opinions or may have an exaggerated opinion. So when we do a research, it disproves these wrong assumptions, and it enables us to explore the truth. How much is aquatic therapy effective? Is it a tool that causes magic? Because this is something which I come across, that the patient who is unable to stand on land, I put him in the water, he starts standing. The patient who is unable to walk, he starts walking in the water, and everybody starts thinking that it is magic. Essentially, there is a lot of science involved, and it doesn't mean that the patient who is in the water will come out and start walking immediately. It doesn't happen. So when we go in the depth and understand more in detail, we understand what is the truth. To find new information and facilitate its application. When I started working more into aquatic therapy, almost spending 8 hours a day seeing patients, the amount of innovations, the amount of ideas we start generating when I'm seeing each patient is so different. And each time, every other session, I start finding new information that I can apply with my next patient. So research is so important that we can collect this information and share it, so that the application of aquatic therapy in itself can become more bigger, more broader, more wider in terms of scope of application. And one of the interesting part of research is you are thinking. It enables you to start critically thinking about things. And why is this happening? How is this happening? What should I do to make this happen again? So this enables me to have an intellectual pleasure of exploring these things. I try to look for different articles. I try to share with my colleagues and ask them these questions. So research is exciting when it's included in practice. It keeps you motivated to see what's the outcome for the next patient, or what strategy can I use in a different way for the next patient. So it is important we have to have this research. It's part of our working culture as well. And in the end, this is for all the clinicians to say that we have to establish, research will help us establish successful revenue generation based on effectiveness. This is very important because as a clinician, we do upskilling ourselves. We may attend different workshops, training programs held in different parts of India. We go and upskill ourselves. But how much of it is effective in my set of patients? This is very crucial for us. The moment I start collecting my own database on what technique is effective for the type of patients that I am receiving, I'll be able to establish a very good guideline for my practice, which will help me become more efficient or effective in my practice. And thereby my charges can be changed. If I'm just applying the techniques that I just learned in the workshop, and I don't have enough reasoning skill, I don't have rationale, and I don't have my own idea of doing my research-based evidence, practice-based evidence, it becomes very difficult for me to say what will be my success rate if I'm seeing a patient. So research is important in various domains, in various perspectives, to be integrated into our practice and academics. What is the purpose here? I really want to stimulate the clinicians to think about research. You have to integrate research in clinical practice. This is very important, especially aquatic therapists. Physiotherapists, it has come a long way, and there is a number of publications in terms of physiotherapy research is increased phenomenally. And because there are a lot of educational institutions which have also started the master's program, PhD programs, there's a huge amount of research in physiotherapy that's increased. But aquatic therapy, not so many. Not so many for various reasons. We'll look at the different reasons and then we come back to it. So it is important that even an aquatic therapy gets integrated in clinical practice. So this is my purpose. And to encourage in-depth research in the field of aquatic. We have come across certain postgraduate articles that talk about before and after, and a simple methodology to identify if aquatic therapy is effective. But we need to start looking at more deeper understanding in terms of biomechanics. What happens to the movement kinematics when a person is immersed in the water? What happens to these kinematics when a person walks faster in the water or slower in the water? Or he's immersed only at hip level, or immersed at knee level, or immersed at chest level. So the kinematics of the movement is going to be significantly different than on land. When we change the velocity of movement, when we change the surface of the body structure, and when we change the temperature of the water. So there are so many variables. So it is important that we understand that we need to focus on more in-depth research in this field of aquatic. And we have to collaborate. It's important as clinicians and also academicians to start broadening our scope, to say that this is not only my thesis or my clinical work, it is going to be effective for patients who have a similar problem. So it will be wonderful if we can collaborate. Let's say one center from Mumbai, one with another center in Pune, with another center in Bangalore, with another center in Delhi. We are going to create a very large cluster sample, which will help us come up with evidence statements. All this while, to be very frank and honest, we've been looking at the Western world to support the research. We understand the research done by them is something which is applicable to our population. But it is important, our population type is different, cultures are different, lifestyle is different, our physical activities are different. So we need to start generating evidence that are locally sourced, that is from the population belonging to this particular region or culture. So we need to collaborate so that we can create evidence statements. This is one. And the other two is to support deeper learning about aquatic therapy among the new breed of aquatic therapists. It's really heartening to see there's so many therapists who are interested in aquatic therapy now. The interest has really spread wide and large, and a lot of queries related with aquatic therapy. And it's time it starts getting integrated in undergraduate level, postgraduate level. We are working on that gradually, and some universities have already started integrating. We did have aquatic therapy in a very small subject, 5 to 10 hours of class, but now it has grown big. At least for, you can have 1 day training program for undergraduate, then a 4-day program for the interns and the PGs. But this enables us to learn more deeper. Why I talk about deeper learning is because if the concepts are not well ingrained, the application becomes different from individual to individual, and thereby the outcome also becomes different from individual. At the moment, there is no standardized education of what aquatic therapy in India, and this needs to be brought into attention so that there is a specific standard, specific methodology of teaching, specific amount of practical hours, and a specific amount of clinical exposure of the therapist to patients. I'm visualizing that at some point you should be having an aquatic therapy rotation in your internship, just like as you have rotation with all different kinds of specialties like MSK patients, Monday neurological patients, and different things. Just like that, you should have a rotation for aquatic therapy. So this is something which will really enable aquatic therapy to sustain in a long. And most importantly, to encourage participation and to review current evidence through journal clubs. Aquatic journal clubs are not there. Most of the academic institutes where master's degree is running on, they have their own journal clubs where they discuss different articles. But the clinicians who are practicing outside, they don't have a platform on which a journal club is there, where they can actually listen to research articles, current evidence, and then discuss about it without any bias, without any judgments, with the purpose of clinically translating that evidence so that it is providing a clinical outcome. Right? So this is all what I want to cover. Let's see if it is possible for me to finish in this time. When I say gaps in research, it essentially means there are 6 or 7 gaps. There are different ways of looking at these gaps, but I'm addressing these gaps with the current amount of literature that is present. When we look at gaps, there is evidence gap, then there is a knowledge gap, there is practical skill-based gap, methodological gap, there is an empirical gap, theoretical gap, and a population gap. Let's look at each gaps and try to understand how this gap is going to be reflected in aquatic therapy literature. Unfortunately, I will not be able to elaborate each individual part, but I can give you an example with one evidence article, and then we can discuss further from it. When we look at evidence-based gap, which is there is little or no evidence to address a research problem. Now, when I look at aquatic therapy literature, there is a lot of information related with aquatic therapy in stroke, aquatic therapy in CP, aquatic therapy in maybe in ACL injuries, not too many, but relatively. And then in certain neurological conditions and only in certain orthopedic conditions. But if I try to look for evidence in, let's say, in women's health, the amount of literature evidence available is not very much. And if I try to look for evidence for sports injuries, which are specifically not ACL, but other types of sports injuries, again, the amount of evidence is not very largely available. Even in neurology, I think the amount of evidence that's currently available is largely for stroke. The gap is present in spinal cord injury and in traumatic brain injuries, how aquatic therapy can play a role. Some extent, there is some information on multiple sclerosis and Parkinson's disease, but still again, there is a huge gap in terms of methodologies, in terms of outcomes, in terms of dosage, and so many details. So this is one big gap that we can see. And if people can take up and address this gap through their clinical work or through their academic projects, this will really be a big step towards establishing or addressing this evidence gap. Then comes knowledge. Knowledge may not exist in the actual field. It might be the case that the result of a study differs from what is expected. So there are certain areas where our knowledge in terms of aquatic therapy is not very, very clear. Simple example for that matter, the kinetic force. When a body is moving inside the water, what is the amount of muscle force that is being generated to overcome the resistance of the water? The resistance of the water is offered by the viscosity. Viscosity is nothing but the thickness of the fluid. So when a person is walking, he has to overcome the resistance of the water. And each time he walks, there are different muscle structures that are getting recruited. The amount of force generated by these muscles are not very clearly understood. There are little studies about kinematic analysis, but the kinetic analysis has not been very possible because of the challenge that to measure quantitative force of the muscle becomes quite challenging when the structure is immersed in the water. So I need to look at some EMG electrodes that are waterproof, which are existing currently, but they have not been able to clearly look at all the movements that happens in the water and give us some kind of a database that says when a person is walking, so much percentage of contraction or such a type of contraction is present in these muscles. We just have theories and postulations from the idea that there is buoyancy, there is upthrust, so the amount of gravitational force is less. So the extension momentum, deflection momentum that normally happens when there is a ground reaction forces is reduced. So the muscle tone may be different and muscle contraction strength may be different. So, but this is a knowledge base that has not been completely explored. So this is a knowledge gap. I don't have enough information about how aquatic therapy can be very effective. However, in some of the areas, the knowledge has been really very interesting, especially the cardiovascular system. The cardiovascular system, the effect of immersion on the heart is well understood. The effect of hot water immersion and cold water immersion on vascular stiffness is well understood. So thereby, we are able to create our treatment strategies and protocols based on this available knowledge. Even the knowledge that what happens to cerebral blood perfusion when a person is immersed in water is also come up. There are many interesting studies now which says, which can, if I'm going to immerse the person in the water for a certain amount of time before actual physiotherapy on the line, the brain can be primed so that the learning and the motor control can be enhanced much better than not being immersed in the water. So there is certain level of knowledge that has really increased in terms of information, but there is still a certain level of knowledge gap that persists, which has not been explored because of technical reasons or because somebody has not considered as important for it to be pursued. So this is a knowledge gap. Practical gap is when a professional behavior or practices deviate from research findings or are not covered by the research. Most of the people who learn aquatic therapy go into the pool and end up doing aquatic exercise and not exactly applying the right techniques for the right problem. This correlation is yet to develop completely. So in my experience, people do take, let's say, a patient with cerebral palsy and work on trunk control, work on head control, work on ambulation, a lot of things. But the exact technical methodologies, what is most effective for this specific approach is not very clear. If they find that the child is already walking in the water, the best way is to encourage them to walk more. That itself could bring about certain level of changes. But can we prepare them to walk better in the water? Can I use some techniques to address the trunk control issues or the weight bearing issues in the leg, in the water itself, and then allow them to? So there is certain variations here, which changes from practitioner to practitioner. So there is this particular practical gap which exists. Some people practice in a different way. Some people practice in a different way. And then comes theoretical. Theory should be applied to certain research issues to generate new insights. And lack of theoretical knowledge may lead to gap in research. For a period of time, as I've been involved in many different concepts, and I work closely, fortunately, with the founders. And when the founders are trying to innovate or develop a new concept, there is always a theory behind it. It says, if I use this particular technique at this depth of water and this temperature, this is what is supposed to develop and happen, right? So, and then they try to hypothesize it, run it around with certain number of people, and then they identify this works and it doesn't work. So there is a big gap as to say, how many people are developing theories that this would work or this would not. A simple example for me, if people have taken WST, water specific therapy, or Halevic concept, is that it works on 3 different rotation patterns, which is based on axis. There is a transversal rotational and then there is a sagittal rotation, and there is a longitudinal rotation, which happens around the axis. A simple example would be, if I'm considering transverse rotation, it purely addresses my anterior group of muscles and posterior group of muscles. For me, the theory is, it is working on anterior kinetic chain, or it is working on posterior kinetic chain. This is a theory again. But do all the muscles get recruited, or all the muscles, if there is a weakness in a specific muscle, can I address this particular weakness by using the technique of WST? Theoretically, yes, it should be. But do I have tools to measure it? Do I have tools to address and identify? That amount of depth of research is still lacking. Likewise, for example, Badarga's ring method is another technique which is based from PNF, principles of PNF being applied in water. And it has got around 24 patterns that we deliver in the water. There has been one study that talked about using EMG electrodes on specific muscles and trying to identify which muscles getting recruited. But still, there is a lot of theoretical knowledge about how it should be effective, how it should be producing a clinical benefit. But when I try to look at the evidence and try to look for articles that have used this particular concept for a clinical outcome, it drops down to very minimum few studies. So there is this big gap. We have the theory, we have the rationale, but it has to be tested. It has to be tested in different ways, with different population sectors, with different clinical problems. So this is a theoretical gap. And then comes empirical gap, where I need to really critically appraise the result that has been obtained. Why did this change happen? Was it by accident, or was it by chance, or was it because I chose the method right? And maybe 2 people used the same techniques, but one person got the result, the other person did not get the right result. So we have to see and go in the depth and identify this. And this is a big gap in aquatic therapy, because we find there are similar studies, similar methodologies, but having different outcomes again. We are not able to standardize this method of treating patients. We have not been able to standardize the method of dosage and the different things. So there are many questions that needs to be really asked and discussed in depth, so that we are able to critically appraise each of them. And finally, the methodology, it's quite similar to what I was relating with. Methodology is where a research method has to be very distinct, so that it can have new insights and to avoid ambiguous findings. And this is important in continuation with all the other gaps, is that choosing the right methodology is important. If a clinical problem is existing, I should be able to choose the right technique, right frequencies, and be able to elaborate the methodology in such a way that it can be reproducible by another person, by another team, and we should be able to get a similar kind of result. This is not very clear in many systematic reviews and meta-analysis that has been done. The methodology is not very consistent, owing to many factors. That one of the is not everybody is trained equally in the same manner. Not everybody is having enough knowledge to apply the same concept in the manner it has to be applied. And not everybody is raising the right research questions to use a methodology that is being used. So there are a lot of variations, and we all understand from aquatic therapy, by our physiological rationale, by using our biomechanical rationale, The outcome has to be very effective. We have anecdotal evidences. We have individual case series examples. But what we don't have is a collective effort to put this evidence together and come up with evidence statement. I'm just going to highlight this, and some of you can feel free to speak here and keep your mics open and just tell what is missing and what should have been. It is just a simple comparison, nothing very in depth. A tale of two studies. I'm putting the same title for both the studies, but this is my first study, which I'm just giving you some information. It says effect of aquatic therapy in arthritis among elderly population. There are 20 subjects chosen. The subjects age group is 60 years and above. And the aquatic exercises was given for 3 times per week for 8 weeks. Pain range of motion were assessed before and after the aquatic intervention. And there was a statistically significant improvement seen in pain and range of motion after the intervention. So with this, I'm able to conclude that aquatic therapy is an effective intervention among the elderly population. So can you all say, maybe in the chat or switch on your mic and say, is there any information missing here? Or do you think this is enough for me to apply aquatic therapy into a clinical practice?
Kindly use the chat.
Okay, I see inclusion criteria. Yes. Anything else do you think you think is not covered here? Very good. What type of aquatic exercises? That is important because it generally says aquatic exercises. It doesn't specifically talk about the type of exercises. Daily activities. Okay. Yes. Okay, that's good. Very important. I like that. This is no information like the depth of the water. What was the temperature of the water being used here? Yes. Yeah, past medical history, we're not so much concerned with it. I'm just looking at basic information in terms of methodology. Type of the study, okay. Whether it was randomized or non-randomized. Yes. Very good. We are also looking for a control group. Yes. Yes, we can also look at lack of a control group here. So you're able to identify the deficits now. You're able to identify that these are the certain things, type of pool temperature protocol. Yes, thank you. So this is the information that is missing here. That is not giving you an entire picture of what was being delivered. Can the study be replicated? No, it may not be exactly be replicated. I don't even know what was the level of pain, what was the range of motion that changed. Was the change that happened was significant? Yes, it is significant statistically, but did it have any clinical relevance? Okay, so I'm just changing the same thing into a little more different. And let me know. It's the same thing, but now if you look at the subjects for the previous and the here, it's 20 subjects. The subjects have increased to 150. This is a larger group of subjects. And 60 to 80 years, 65 male subjects and 85 female subjects. Elderly with uncontrolled comorbidities were excluded. Elderly with the ability to ambulate 100 meters were included. The aquatic therapy session was 3 times for 10 weeks, 45-minute session, chest level immersion, moderate intensity activities, closed kinematic exercises. There is an appendix that talks about what type of exercises were given. Vitals were assessed before and after. And if you look at the outcome measures chosen, it says about functional ambulation category and quality of life, TUG, WOMAC scores were assessed before and after aquatic intervention. Statistically and clinically significant improvement in outcome parameters. And again, it stays the same statement, effect of aquatic therapy in arthritis among elderly population with arthritis. Okay, so what do you think here is still missing? We have covered most of the details from the previous study. It is much more improvised than the previous study. And some of the factors from what you've already mentioned is missing here also. There is maybe temperature. Let's consider to be thermoneutral temperature, essentially, and there is no control group here again. We are just trying to evaluate whether aquatic therapy is effective in elderly population, aquatic therapy before and after. Then we can add a control group that can make the study more stronger. We can add randomization to it, which will make it more stronger. We can blind the assessor, which will make it more stronger. We can conceal the allocation, that will make it more stronger. So as you see, the level of evidence, it's the same type of study, but I changed some parameters with the previous one, where the level of information was much lesser. And I changed to this type of study where the level of information was much higher. So we have to understand this and very clearly address this particular gap that was present in this study. This study addressed the gap, majority of the gap. But again, when we go to the certain in-depth research, there are certain more parameters that I can add on to make the study become more strong. So you've got a fair idea now how to look at the article. And this is all you need to understand when I'm looking at a journal. Most of the time research and somebody, if I tell, please read this article to a practitioner, they don't have time to read it because they have to see one patient and another patient. And the most important thing is reading a research article doesn't get you money, doesn't pay you anything extra. It is an investment of time, which will be applied at a later point of time. So in that time, I would love to see another patient and get my charges done. So there is a lack of this practice to be interested in research and look at the articles and read about it and understand what is the current literature happening, discuss with the peer group, come back and check what are the things that I can add on so that my treatment becomes more effective. Because this is some culture as a habit that needs to be changed. I'm speaking this from an experience of being part of an aquatic journal club for past 2 years. It is an international aquatic journal club. And when we started, we were a very small group of people, and it has been announced to a global group of people where there are more than 120 therapists, and to our ATNI group also where there are more than 400 therapists. Out of a population of 650 therapists, when you hold this journal club, the attendance is just 10 people. 10 people, the highest we have reached is maybe 18 therapists. So you can understand from a clinic, and both of these groups has more clinicians than academicians. Okay? So this is a simple understanding that after 2 years and at the rate of having 2 journals every month, we have had more than 40-45 journals being presented within our group. We have discussed so many research topics, but the percentage of attendance of clinicians into this journal was very minimal, very minimal. And this is a trend that needs to change, and it is changing. I'm really happy now that there are a lot of Indian therapists participating, but this has to change overall so that we can have more evidence-based information with which I can take the clinical decision, and also find out which area needs more research to be done so that I can apply it in my clinical practice and develop that research. I'm just presenting one article. This is not to look at the systematic review and meta-analysis. My intention is not to do that. My intention here is to see what it concludes. And likewise, many systematic reviews and meta-analysis, what are they concluding about? They have got the right data extraction method. They have chosen the kind of outcomes that they have to take in case of aquatic therapy on mobility, balance, and level of functional independence in stroke rehab. The functional reach test, the timed up and go test, gait speed, work balance scale, they were all considered in most of the studies. But when you look at the conclusion, what it says is that the effect of aquatic therapy on mobility and balance is statistically significant when compared to land-based therapy, but the clinical significance is less clear, highly variable, and outcome measure dependent. So this is something which we see in our academic researches, that we are able to prove statistically significant changes, but we are not able to get a result that is clinically important for the patient himself. So we have to start looking at this big gap to move from a statistically significant outcome to a clinically significant outcome. But our techniques and methods not only make a statistically significant change, but it should also be able to achieve that minimal clinically detectable change in the patient. So we can say that there is an improvement that matters to the patient and not for the statistics. Okay, I'm just giving you one highlight or an example of how the systematic reviews are coming up with this. It is quite a similar outcome even in another stroke rehab outcome that we checked, or also systematic review in cerebral palsy, and also systematic review that we did for osteoarthritis. So there are a lot of reviews that are saying that our methodology is not the same across the spectrum, but individually we are able to achieve a better result than compared to land in some of the studies. But again, the level of evidence is low because the quality of the study that is being done is not. So the clinical message from this group was there was further need to evaluate standardized aquatic therapy protocols. As I mentioned with the example before, we have to understand the timing of recruitment, like an acute stroke, subacute stroke, chronic stroke, all that has to be clearly made. The type, duration, type of exercise being done, duration being given, what was the dose, how many times the exercise was being given, for how long the exercise was given. All those details have to be mentioned. And again, as I mentioned in my previous slide, minimal clinically important difference values of outcome measures have to be considered. And multi-center trials, not only, don't focus only on one area, we need more heterogeneous samples. The more heterogeneous samples we have, the more we are able to say that, yes, aquatic therapy is effective in stroke in improving gait parameters, or aquatic therapy is effective in, let's say, initial phases of stage 1 osteoarthritic changes, in recovering pain and in establishing a functional ambulation, which will be useful for quality of life. So we have to understand this very clearly and try to look at broader studies. So this was something I spoke, which was academically oriented. If I look at all these gaps in research, this is something that's present in the research field itself. When you say research gap, and you'll find these parameters being shown in the literature for you. What I'm also trying to emphasize here is the practical or realistic gaps. Let's realistically ask ourselves, why are we doing the research? Essentially, I think it is a fulfillment for an academic requirement. Honestly, including myself, I'm now focusing on the clinical oriented research at the place where I'm working now. It took me almost 6 years to establish and to reach this level where research is being considered, and we are putting up at least 6 or 7 very new ideas of research, including kinematic analysis of gait into the water between stroke and normal, in the stroke between land and water. But earlier, even when I was in academics, the purpose of research was a requirement as a fulfillment of academic objective. That is, I have my post-graduation thesis coming up. I need to pick up a topic. Then there is a big collaboration between the faculties of the college and then the student. Then we try to find something which I can finish in 2 years, and where the number of patients available are easily possible. And then the data that comes out is sometimes realistic, sometimes unrealistic. We try to achieve the outcome that we had already decided that has to come. So all those things are a gap for me. So a research now has to happen from the perspective that we have to identify or search for something very clearly. The true definition of research needs to be executed. And for this, academicians have to start looking at more intervention-based research outcomes and not a survey-based research outcomes. This was also a trend in academics, honestly. No heart, not to target anybody, but that's the natural process that happens in all our academic institutions. Doing a survey is more easier than doing an intervention-based research. It's very natural. I have a little time, but I can sit and prepare a survey, give it to people, ask them to fill it up, and it comes back, and I analyze the data. Whereas an intervention strategy requires you to actually follow up with the patients, the data that needs to be analyzed, the intervention that has to be delivered. and try to keep the same intervention in all the events, and then collect the data and then make a clinical statement, which takes a longer time, and the outcome may be or may not be the way in direction that you are thinking. So we have to really ask ourselves this question: what is the purpose of research that I want to do in aquatic therapy? Is it to fulfill an aquatic requirement, academic requirement, or to actually find out if the technique is effective in this patient or not? And we need to look at the latter one to see if we can apply this technique and it can bring about a big change in the clinical outcome of the patient. We have to start looking at this. The next important question that I have asked myself, and I would share it in all my training programs, and I also like to put it for you all, is who is doing the research? If you take up any articles that has been published, systematic review or any of the clinical outcomes, and if I take up 10 articles, believe me, out of that 8 will be from universities. You look at the authors and then look at the where do they belong? They are from university. So who is supposed to do the research, academicians or clinicians? For me, clinicians have got a better input, a larger amount of data that they can share, purely from the perspective, because when I see a patient, if he gets the result, he's going to pay me. So as a clinician, what I tend to do is I try to find the most effective technique or approach. I find out my own methodology and then I treat this patient so that I can achieve the outcome and I can charge him something and then I get back. And that data, that what worked for this patient is my data, which I know that is effective in this patient's. Then I do not publish it. I keep it with myself. But over a period of time, I've collected such a lot of data that I know what is most effective for a OA patient. I know what is the most effective strategy for a stroke patient, what is the most effective strategy in spinal cord injury, but the data is not getting published. Okay. So a clinician who is actually finding out a clinical outcome or clinically relevant data is not publishing, but whereas in academicians, where their generating results may not be the primary target, the primary achievement will be to complete the research project. So these are two different domains. I don't say the academicians do not look at it, but I'm telling predominantly the majority of the objective of an academician is to complete a research project than at looking at a clinical outcome of the patient. So this is something which we have to consider, which is a big gap. So this has to be addressed by the clinicians. Clinicians have to get more active in trying to involve themselves into research and sparing some time and then looking at publishing the collective data. What is the level of knowledge required to do research? Aquatic therapy is relatively new. After so many years, even at this point, I know myself that there are so many areas that I'm not very clear with. I'm still learning. Every year I undergo training. I go for learning more things. And when we start taking research as a question or a research project, I really need to be well educated in the concept which I'm going to be applying, have some experience in applying this concept in different type of population, and then I'll be able to generate the right research question and then look at what is the best technique that can help this patient. So the level of knowledge at the moment is new. I wouldn't say it's if people are doing a 3-day program, 4-day, 1-week program, 10 days program. But again, as I said, the number of concepts that are available in aquatic therapy is large. There is a mixed match, and a lot of people learning in different ways. And they need to apply all this and then look at gaining some experience and then look at the type of population they are seeing and then develop a research question. So the level of education that needs to be done now is much more in depth in requirement, and having more clinical experience and learning it from the patients itself is more important, because patients are your best teachers, and that education has to come from them, and which means that you need to spend more time in the pool and more time with the patients so that whatever you've learned gets more clearly absorbed, and then you start doing your research. So that should be level of knowledge, which I would say in terms of Dreyfus model of competency would be at least a practitioner level. And that comes to the next question. What is the level of skill required? So you don't only have knowledge, you also need to have the skill. Because in aquatic therapy, how you hold the patient in the water, how you deliver the technique in the water, and how you're able to translate the dynamics of water into a clinically meaningful technique or a clinically meaningful therapeutic procedure. This is very important. And that comes only with experience. And you need to be in the water for a certain level of time. You need to try out and experiment with different ideas and strategies. And then once you develop the skill, then you will be in the right position to ask and raise a research question and deliver it in the right way. If I try to do it at an undergraduate level, your research questions will be too superficial. You'll be finding it difficult because the time and the knowledge that is available is not very deep. Raising the right research question. This is also a big gap also, I think. Are we raising the right research questions, or are we raising the research question that is easy or convenient for us to complete, or what we call as the feasibility, you know? But of course, we look at the feasibility of the research in that specific area, but we try to be more favoring towards what is easy for us rather than what can be challenging, or what could be the most exciting new techniques that can be developed when I'm doing the research. As I mentioned earlier, most of us tend to stick with something survey if I do not want to intervene, but we do require qualitative studies, we do require quantitative studies. So we need to establish a right balance between those, a quantitative study that can also have a qualitative assessment of the quantitative intervention will be very good blended with both together. Okay? So these are certain practical and realistic gaps I'm looking at. Some of the things I've already mentioned, methodology. I also spoke about clinical areas where there is more requirement of the research that can go ahead further. Even in pulmonary rehab, also there is, during COVID, we for the first time took cases with COVID, long COVID, and we were able to deliver something what the land-based therapists could not deliver. So we were able to have the patient in the pool with the oxygen cylinder, with a long cannula. We gave different depth of water, we gave different intensity of exercise, we monitored their saturation level, we monitored their vitals in the sessions, and we identified and we came up with the right dosage of exercise and also the right method of delivering this dose of exercise to the patients. That helped us to come up with a statement, aquatic therapy statement for treating COVID patients. You know? And so that was a very good research-based, or let's say clinical-based information that we were able to gather and deliver it with correlation from different evidences developed with previous studies that were associated with pulmonary conditions. All right. And we have to try to look at developing very high level of evidence, RCTs, blinding, choosing a bigger, larger sample size, cluster samples, and also reduce a research bias. You know, sometimes we find it very easy that the sampling, is more easier when I already know that these are the people who are going to come to me, and I'm going to choose a sample that is convenient for me, or choose a hypothesis that is that we already know would happen at some point, and then we try to contradict with a null hypothesis and then do this. So we have to also reduce this research bias and try to look at the right literature review, and not manipulate the data that we have received, that we have in our research findings, just because I want to prove a hypothesis. So we need to come out of all of this research bias and try to prove our research studies, because when I'm doing my training program, there is one particular task I give it all my participants is to look for researchers and present this research on one of the days. And generally I tell them to find two kinds of articles, one that favors aquatic therapy and the other one that does not favor aquatic. But when they start searching for it, most of them find the articles that favors aquatic therapy and very little article that talks negatively about it. That means we have a huge gap where I'm not trying to know the limitations of aquatic, where I have not been able to understand that aquatic therapy may not be useful in this area and is useful, may not be applied in this area, so that I can determine and tell the patient, no sir, aquatic therapy is not going to help in this area because evidence doesn't support. But we have a lot of data that is already biased towards it being very effective. This is what I'm telling about research bias. So this is one of my last slides. I'm about to finish. This is the strategies to bridge these gaps. What are the things that we need to do across in India to address these issues? Some 8 steps, but these are not exhaustive. You can also add on to it. You can make suggestions. I can also take it down, add on to this particular data that is already there. First is to centralize resources. Please create a research group. We need to have an Aquatic research group, which will help all of the clinicians to develop new research strategies, treatment strategies, apply it on the field, and then develop data. Okay. Access to research databases. So there are a lot of articles that are available freely, but there are certain important articles that may not be available. So somewhere like IAP or ATNI could develop an access, create an agreement, pay some kind of subscription, create access to this research database. And if I look at clinicians, they don't have time. So maybe having a research assistant would be really helpful. So there can be one research assistant for one area of Mumbai, and say everybody in that area can direct all their data findings to this particular research assistant, and the research assistant can help them find out the literature review, support the outcome measures, and help them in publishing those articles as well. And create some research centers where the entire intervention is only research based. So you have one aquatic therapy center, and everything that happens there is based on research. And then all the new techniques and the most complex cases and the challenging cases can be seen there with different approaches. This is what I mentioned by centralizing resources. Standardizing competency, we have exams to pass, but the competency is not very clear. Competency is different from passing the exam. Passing the exam doesn't essentially make you competent to practice. These are two different entities that we need to identify and understand. The competency, the educational activity should be a competency based. And we should also look at specialized based competency, where aquatic therapist in neurology, which means that they have to be very specifically having competency to handle neurological patients. And documentation, standardization, journal club for initiates, and scope of practice has to be increased. So there are more patients who are receiving aquatic therapy. So I have my research being extended into more clinical areas. And educational activity be standardized across universities, hold regular continued medical education programs, upskilling on a yearly basis, every year, learn new skills of aquatic therapy, support it with the competencies, and then practice in the field, generate data, then publish it. And publishing comes with definitely a cost. So we have to look for supporting the researchers or the clinicians with grants for doing high-end research. And we also have to create a database of funding agencies who can support the research, and also to create software-based data collection areas where multiple people can share the data to a centralized server or something like that, where I'm able to collect data of large group of sample of populations. And integration in practitioner renewals. This is a concept that is not existing in India. It has to start, we have to start looking at it, that every year a license for an aquatic therapist has to be created. And this license has to be renewed periodically with CPD points. And this is something which I'm experiencing here at the place where I work in Qatar. And also it's the same in US, also it's the same in UK and other countries, where you need to regularly renew your license. And so you have to do your studies on a regular basis. So from that perspective, we can make participation in research as mandatory, because this is important, because every year a clinician has to keep on upgrading himself, keep himself competent to the current market changes, keep himself competent to deliver the right type of care, so that by and large, the profession of aquatic therapy will remain at a higher standards of practice. Just because somebody is not practicing or not participating in research, their level of intervention may be at a lower level where the others have reached higher. The idea is to keep everybody on a similar standards of clinical competency. So these are some suggestions and ideas. With that, I conclude. So to conclude, I would say that the possibilities for research in aquatic therapy is large. So this is out. There is the amount of research that we can carry out in aquatic therapy is huge in India. We are just in the beginning. Aquatic therapy practice, infrastructure, the education is still in its infancy. There is lots to grow, and a lot of system-wide changes can happen, and it can get integrated in the mainstream physiotherapy as a parallel line of profession. So you can be a physiotherapist, you can also be an aquatic physiotherapist. And concept-based research data is less. I've listed out certain concepts here, which most of you would know if you've been following aquatic therapy. And lack of interest and complexity of research or complexity, it needs support among the clinicians. People who are practicing, and with my interaction, I've understood that the research may appear complex to them because of words, terminologies, the process, the statistics. It is really quite confusing. So they may need a lot of assistance. We need to encourage them to participate, keep the complex data as simple as possible, and encourage them to focus on research. And support for publishing research is very essential. We still do not have anything in India. We're looking at aquatic journals all across, or we're publishing in journals that are for physiotherapy, but aquatic therapy is going into it. And the biggest boost that we can have is having India's own international journal on aquatic therapy. It can bring about a big kind of a revolution in this part of the world, which can support everybody to start looking at aquatic therapy as a research topic and contribute more and bridge all the knowledge-based, practical-based, evidence-based gaps, and achieve aquatic therapy to be a sustainable concept. Thank you so much. That's my email ID if you want to write me an email, and I will be available on WhatsApp on this number. It's an international number, so please ensure that you mention +974 in the beginning. And it's open for questions.
Thank you so much, Doctor, for the insightful presentation. Definitely, there is a dearth of intervention-based data, and with the strategies to bridge the large gap, hopefully this motivates more clinicians to publish what they practice. Now, it's time for a question and answer session. While we'll try to answer as many questions as the time allows, please understand that we will not be able to address every question. So if you do have any question, please do feel to reach out us afterwards as well. Okay, that being said, let's get started. So please go ahead and type your questions in the chat box, and I would like to hand over the mic to Dr. Gauri Wag to take over. Over to you, Dr. Gauri.
Good evening, everyone. Dr. Prashant, it was indeed very knowledgeable session, and I'm sure our audience have got fair idea about the recent research advances in aquatic therapy, and must be motivated to take up the field and contribute to further research. So we have a few questions here already. We would take that up one by one. The first question is, clinicians usually lack guidance and support from educational institutions or universities. Could you suggest any organization or community support that would help the clinicians who are interested in the field of aquatic therapy research?
Yeah, I would love to contribute in this area. At the moment, Aquatic Therapy Network of India is planning to come up with a research wing where we want to have funding for the research projects that would come up based on each individual projects. We would like to see if there is a funding possible, but that's on the pipeline. But you can also apply for ICMR, which is also based on certain special areas. It can help you with research funding. And I believe IAP, if I'm not so sure, also has a certain amount of funding available, if I'm not wrong. Maybe Dr. Smarnika can correct me.
Yes, sir, we have.
Yeah, so we do have an area where they can help you with that as well. And there are many other research supporting. I had applied once for Tata Research Foundation, I think. I'm not very sure. To one of my research projects I have applied there as well. So it depends on the each individual foundations or the funding agency's objective to support research. If your topic is in their domain of area, they will fund you. If not, then we have to keep looking for other areas. I hope that answers the question. But as of now, at the present moment, aquatic funding directly from an aquatic organization, in my knowledge, I'm not aware that such an, especially in India, is available. If it's available, I would love to know as well.
Yes, thank you. Our next question is how to get ethical committee clearance for this clinician who do
Sorry,
not comes from university.
your voice broke. Can I?
How to get ethical committee clearance for this clinicians or researchers?
Yeah. Well, again, this is another big question because for the clinicians, there is no specific ethical committee available. You may have to associate yourself with an university, or if there is a private practitioners group or a group of people, then you have to establish your own ethical committee, get it registered, and then start getting the approval. These are also the challenges that we have in terms of clearance or getting in clearance from the ethical committee. It all depends on your type of intervention. If your intervention is just an observational study, then ethical clearance essentially may not have a big influential role. But if it is an intervention study, yes, ethical clearance becomes important. And ethical clearance becomes more important if the patient is also having certain level of comorbidities. So at the moment, try to look at nearby educational institutions or organizations who can independently accept you. There are certain ethical committees which are independent. They can help you accept certain of your research studies if you're within their ethical parameters or if you fulfill their ethical requirements. It's possible. Again, ATNI will at some point come up with a support for this aspect. We're looking at hiring a research assistant, creating an ethical committee, and creating a research fund. But those are all in the pipeline yet. It is yet to be executed on the ground.
Okay, Doctor, thank you. Our next question is, are there any qualitative research articles published for significance of aquatic therapy for orthopedic conditions? What is the scope in this regard?
This is a very good question, because most of the time we do not consider how the patient feels as a subjective experience at the end of the aquatic session. There has been certain qualitative studies that has been done. If I can find out, and I'll share it up later, or send me on WhatsApp, I'll try to share it with you. There has been a qualitative study where there was a structured, semi-structured questionnaire being given to parents of the children with cerebral palsy, and they try to identify how did the child find aquatic session, did they sleep well after the aquatic session. There are certain qualitative questions which are very subjective, and we have received a very positive response that says people are generally happy with aquatic therapy. There is another study, I'm not very sure if it's associated with osteoarthritis or the knee pain, and in my memory, I have another study, if I can recollect and I can share it with you. It was also a subjective qualitative study where it was for patients with MS. I think Mr. Krishna Kumar from UK had presented this study. He did it for almost 2 years about asking the right qualitative questions, because when we start asking these questions after asking 10, 20 people, most of their information will get concised into few areas. So based on these areas, I think he developed around 15 or 17 questions that he asked them, and then he was able to obtain answers. If possible, I'll try to share. We have a webinar on that as well in ATNI website, and I can share the link with you later. I can share it with you. So yes, there is a certain amount of qualitative studies available.
Thank you, Doctor. Do we have any website for documenting all this specific aquatic research articles or the published articles?
No, we don't have, but we are creating a library under ATNI where we want to make a collection of all the articles published in India. Our research team has already done certain amount of collection. We will be able to upload it after certain time, so we have access to them as well. And we are trying to develop a database of freely available research articles in aquatic therapy. But that's a lot of work because we have to index it and then make it available in a very systematic manner on the website. But again, that would be taken maybe until the end of next year. Because many research articles get published, we need to establish a way how we can collect these articles and keep updating the research database from time to time. So we are to come up with an action plan, but we have it on the plan. the website also has an area there in our library as a resources, but we are to put all the articles that we have in the database uploaded there. But currently, no. But you can look at certain areas, for example, certain of the companies, for example, AEA has its own website, aeawave.org has got certain information on their website. And IATF, the organization that I'm associated with and an assistant lecturer, it also has certain webinars and certain level of information available on the website about clinical IG, about Badraga's ring method, about WST. There are certain literatures available. We can also look at some videos and also certain research articles that have been published. And certain conference proceedings are also available on that website that you can take it. And also there is another concept called as Watsu. Even they also have a certain amount of data published on their website. So this currently, each individual concept have their own websites with which the data is available, supporting their own concepts.
Thank you, Doctor. Could you please enlist the organizations that offer courses for educational research?
Yes, sorry, your voice broke in between.
I'll repeat my question. Could you enlist the institutions or organizations that are offering offline certification courses in aquatic therapy?
Okay. It depends on what you want to learn, because as I said, aquatic therapy is a very large field. I started my journey from seeing patients in exceptional children's school. My journey started with pediatric patients by looking into books in my library and translating physiotherapy knowledge into aquatic therapy and understanding the dynamics. Then I did my International Halliwick Foundation course, which was based on Halliwick concept. Later on, I went on to do a course in IATF about WST, BRRM, and IG and this aqua fitness and other things like that. So there are different organizations that you have to look for and start learning about it. IATF is one that is organizing courses in India. And also I'm holding my own foundation courses in India that I hold like every 1 year, 2 programs a year. And I'm trying to bridge all these organizations together, IATF, the fitness and well-being. So at present, the way I'm trying to build aquatic therapy within Qatar is aquatic therapy is a holistic tool. You have to start treating water as a holistic tool, which means you have to bring in therapy, fitness, and well-being under one roof. So, but they are not under, these are not being taught by one organization. These are being taught by 3 different organizations. So you have to do something associated with therapy with IATF, something associated with well-being with Watsu, something associated with fitness being done with AEA. So ATNI is holding its own foundation courses, which I'm a part, and then I take courses annually. Johan Lambach visits India very frequently now. So he's doing some courses from IATF. At the same time, Watsu India has its base in Pondicherry, and they hold their own courses, all Watsu related courses there. So Watsu.in would be one of the area that you would want to look at, or type in Watsu India and you should be able to find this information. These are the places where offline courses are being done.
Thank you, Doctor. Lastly, our viewers would like to know what are the further prospects or your vision and advances that could be further made in aquatic therapy.
Wow, okay. This is a very interesting question because in my perspective, when I finished my course and came to India from Switzerland in 2010, I was the first person to finish it here. And I didn't have anybody to speak or talk or reflect on whether my technique is right, wrong. And then slowly the idea of networking came into mind, and then the network has grown big. So Aquatic Therapy Network of India was something which we established at that point of time. And we want to collaborate with IAP. We want to collaborate with international organizations. At the moment, we are academic partners with AEA, Aquatic Exercise Association, which is the largest fitness association in the world. We are part of it. And our students get 20%, our members, ATNM members get 20% discount on the fee in general. Watsu India is another organization that I'm supporting, participating with ATNI. So they also get some 10% discount. I think it's case by case based on the type of course that they are taking. And we are also associated with IATF, wherein we encourage participants to learn about this course. What we are trying to look at is in terms of education, we really want to go in depth, come up with something like a fellowship, come up with a post-graduation course in aquatic therapy in the longer run. And we are trying to look at competency, in terms of competency, that our Indian aquatic therapists should reach a competency that's of the highest standard in terms of practice. And also to establish world-class rehab centers, aquatic rehab centers. And this process is already on. There is one that we established, integrated hospital in Dharampur, which was inaugurated by the Prime Minister of India. So we have got, the idea now is to focus on research and to start seeing that we have a huge population in India. We have with varied clinical conditions. There are a lot of therapists. Now the infrastructure is coming up. Now India has to start making evidence statements as to say what is effective in what type of patients. So currently the idea is to elevate research in India in aquatic therapy, make more people get involved into research and increase the level of competency amongst the therapists, and to start having this license to practice, which has to be constantly upgraded every 2 years by doing CPD points, which means there should be a constant education so that therapists always remain at the best of their competency skills. This is something what I'm imagining. Thank you for this question.
Thank you so much, Doctor. We have one of the audiences raising their hand to ask question. Dr.
Sure.
Smarnika, could you allow them to ask the question, please?
I have already given the access.
Mr.
Yes,
Ankit
Mr.
Anand, you can ask the question.
Okay.
I have given the access. I think we'll move forward.
Okay.
Okay, we'll move
Say
forward.
Again, I'm giving it another time, but he's not taking the access.
Okay, if there are any further queries, you can mail the queries to the email address that is shown on the slide. So we'll end the question and answer session here. Dr. Palasha, over to you.
Am I audible?
Yes, yes.
Yes, you are.
Sir, good evening, sir.
So, hello, Ankit. Good evening.
So my question is there, sir. In loss of
Ankit, I would like to interrupt you. You're using two devices, and that is the reason there is an echo.
no, madam, it's from your side, I think.
I have muted you. Now you'll be fine. Talk.
Am I audible?
Yes.
Am I audible now?
Yes.
Yes, Mr. Ankit. Yes.
Hello. Am I audible, madam?
Yes, Ankit.
Yes,
You
yes,
are
Mr.
audible? We are able to hear you.
Like most of the cases I have seen, like whenever I ask the pre and post like results in different scenario, so they are not able to provide. In the past 1 year back, I had asked for the hemophilia cases also. So I want, sir, if possible, let me show something like pre and post assessment results, so I can make some difference. Because like in government department, they have one R&D team, research and diagnosis department. They have some grants. So hello.
Ankit, you're audible. Please continue.
Hello.
It's very low. It can increase the volume. Okay.
Yes, Mr. Ankit. You can continue.
He's muted himself again.
You can write down in the chat box below, or you can email it to sir as well in case if you have any questions. All right. Okay. So thank you so much, sir, for your wonderful insights. I stand before you with heart full of gratitude as we conclude today's webinar on our topic today. requesting Dr. Gauri to give vote of thanks.
Thank you, Palasha.
Thank you, Dr. Palasha. So as we conclude today's very informative session, myself, Dr. Gauri Kamatwag, hereby take this opportunity on behalf of IAP Women's Cell Goa to thank first and foremost our very esteemed speaker for the webinar, Dr. C.G. Prashant sir, for accepting our invitation to be the resource person for the webinar and enlightening us about the extensive field of aquatic therapy, the research opportunities that we have in this field. So it was very comprehensive talk. Thank you very much for this wonderful session. And I'm sure many therapists would be inspired to take up this field and contribute to the research. I also thank all our spectators for actively participating in the session. I also take this opportunity to thank IAP CEC for providing this platform for us and IAP Women's Cell for successfully organizing this webinar. I also take the opportunity to thank the technical team for their constant support throughout the webinar. Thank you, everyone. Have a great weekend.
Thank you, Dr. Gauri. Thank you, Palasha, and thank you, Dr. Smanika, and thanks to IP for this wonderful platform. I enjoyed the interaction. I hope the topic was useful. Thank you so much. And good
Thank
night,
you so much,
everybody.
sir.
Good night.
Good night.
Thank you.
With that, we conclude